Well, welcome everyone, and thank you for joining us live and those listening afterwards at the posted recording. I'd like to warmly welcome our guests, and I'll introduce them to you in a very few moments. My name is Ron Goose, and I'm currently the chair of the FIP Regulators Forum. FIP's mission is a world where everyone benefits from safe, effective, quality, and affordable medicines and health technologies. Our mission is to support global health by enabling advancement of pharmaceutical practice, science, and education. We are pleased to be delivering this 3.7 event of the webinar series, Transforming Vaccinations Globally and Regionally. Today's event is entitled From Regional to Global, Common Priorities for Action to Transform Vaccinations. Just some housekeeping announcements first. This webinar is being recorded and live streamed via Facebook. The recording will be freely available at our website, www.fib.org. You may ask questions using the question box provided, and you're welcome to provide feedback to webinars@fip.org. And to become an FIP member, we wish you would. If you're not already, please do so at www.fip.org/membership registration. So welcome to today's FIP seminar. I am one of the moderators today. My name is Ron Goose, and I am from Canada. I received a Bachelor of Science in Pharmacy at the University of Manitoba in Canada in 1979, and I've been actively involved in public protection as a regulator in pharmacy practice for over 30 years. I've been involved locally, nationally, and internationally with organizations focused on patient safety. Presently, I'm the Canadian consultant for the American-based National Association of Boards of Pharmacy, and I most recently became the chair of FIP's Regulators Forum. I'm pleased to welcome my co-moderator, Lena Bader, who is FIP's lead for workforce transformation and development, and also the lead for transforming vaccinations globally and regionally. Lena, I'll turn it over to you.
Thank you very much, Ron, for that wonderful introduction, and very pleased to be here with all of you today. Thank you for joining us. So just wanted to, hopefully, a lot of you have already been familiar with our Transforming Vaccination. This shouldn't be your first event. This is, in fact, the 23rd event in this global series. The next slide just gives us a reminder of what this program is really about. The Transforming Vaccination Regionally and Globally program is the first FIP transformation outcome-based online program of its kind that is underpinned by the FIP development goals. The final outcome of this program is a historic global FIP commitment to action on vaccination and pharmacy, which we are planning to launch on the summit on Thursday, and we'll tell you more about the summit shortly. And we are planning for a collection early next year to capture and collate all of the outcomes and deliverables from this program as well. So please look out for the collection coming out early next year. And the next slide just also reminds us of the journey that we've taken together since the beginning of this program in September. The program consists of 24 events divided into 3 series, 8 events each. The first series focused on identifying transformation needs for vaccination across science, practice, and workforce and education. And we have, as a result or an outcome, identified some key priority areas for responding to these needs that we'll be sharing with you as well. The second series, which again, another set of 8 events that ran between October and November, have focused on deconstructing the vaccination agenda through the eyes of the FIP development goals. So we have focused on some key FIP development goals that impact or are relevant to vaccination, and have identified mechanisms for each of these goals to support us with transforming vaccination. And in the third and final series, which we are nearly at the end of, is all about committing to transformation and identifying regional priorities across the world, and of course making the global commitment together during the summit. So this is the last, the almost final event before the last event in the third series. Just as another roundup of what this series 3 has been about, the next slide shows you a very short video to navigate you through all of the regions we've been through together. So over the course of the past 2 weeks, we have covered the 6 world regions, and today we are here together to listen to the common priorities emerging from all of the 6 regions. So today's roundtable really sums up all of these outcomes together. So just a reminder of some important links and resources. Everything you need to find out about this program, including past recordings and events, can be found on transformingvaccination.fip.org. So please visit that to look back and explore all of the free resources that have come with this event, and of course register to our last event on Thursday, and we'll share those links in the chat so you can join us during the summit. We'd like to remind you to, as usual, stay engaged with us during the event. Use the chat box to share some thoughts from your countries, from your local institutions, and your individual experiences. And here are some questions to help with that. What single factor should be prioritized to transform pharmacy vaccination services globally and regionally, in your opinion? Please let us know. What would be the most important achievement, in your opinion, in terms of pharmacy vaccination services in your country over the next few years? And what else should FIP commitment to action commit to? If you have questions to the panelists, please, as Ron has mentioned, use the Q&A box for that so we can capture those, and use the chat for any additional comments, reflections, and introducing yourself. We'd love to know who you are and where you're coming from. We'll go to the next slide, which just is about to help us kickstart today's event. What is today about? So as I've mentioned, we have covered over the past 2 weeks all 6 regions through a dedicated event per region, and you can go back and look at those at your own time. Today is about coming together and understand and identify the commonalities, the common issues, the common barriers, the common priorities across all of these regions to help us deliver on a global scale the transformation of vaccination. The next slide just gives us a roundup of who we have with us today, and my colleague Ron will do more in-depth introductions. We have from each of these 6 events our regional leaders who have come back here, and we are very grateful for their presence with us today, to report back on the outcomes of the events they have moderated. We have G. Simalata coming here to represent Southeast Asian reflections and outcomes, Nadia Al-Mazroui representing the Eastern Mediterranean region, Prosper Hiag representing the African Pharmaceutical Forum and the results and outcomes of the African regional event. Stephanie here to report back on some priorities emerging from Europe, and John Jackson reflecting on the most pertinent issues coming out of the Western Pacific regional event and regional stakeholders. And last but not least, we'll hear from Eduardo Savio, who will be representing the 6th region, the Americas. At the next slide, at this point, I'll hand back over to Ron to help us introduce the events and the speakers in order. Thank you, Ron. Back over to you.
Thank you, Lena. Next slide, please. The first of our 6 regions, event 3.1 on the regional leads and drivers for transforming vaccination in Europe. This event involved discussing the progress made in European countries with regards to pharmacist vaccination, the quality and universal access to vaccinations. We also discussed barriers and challenges and regional needs for future transformations. It's important to know that the WHO regional officer joined and offered full support for pharmacy-based vaccinations, and we thank them greatly. I'm now pleased to introduce Stephanie Cole. Stephanie holds an LLM in European law and works at the European Association of Hospital Pharmacists, which represents and develops the hospital pharmacy profession within Europe to ensure continuous improvement of care and outcomes for patients in hospital setting. In her role as Policy and Advocacy Officer, she coordinates and supports the Association's policy engagement on many health policy topics relevant to hospital pharmacists, including but not limited to medicine shortages, antimicrobial resistance, procurement, digital health, vaccinations, and falsified medicines directive. Before joining the association, Stephanie worked for a consultancy group that supported the European Commission in examining and implementation of EU legislation in various member states, such as the European Cross-Border Healthcare Directive. Stephanie, I'll turn it over to you.
Thank you so much, Ron. And I'm happy that I get the opportunity to feed back to you from the very first event that kicked off the third series. And as you just heard from Ron, we had a number of great speakers from all across the European region, including community pharmacists, academia, full service healthcare distributors, and our special guest from WHO. During the event, the speakers shared information about flu vaccinations in pharmacies by pharmacists. Examples provided us with insights from different European countries, such as, for example, Denmark, Estonia, France, Germany, Greece, Ireland, Norway, Switzerland, and the UK. We heard from DERP, the association at European level representing full-line service healthcare distributors, on the safe and efficient delivery of vaccines to European cities, including some information of the long-awaited COVID-19 vaccine. We had representatives from Malta, Belgium, Turkey, who shared how pharmacists in their country are being empowered to transform vaccination. And they outlined how they have initiated this process, or how they're still in the process of initiating immunization in community pharmacies by pharmacists. And our special guest from the WHO Regional Office for Europe talked about the WHO Immunization Agenda 2030. And we also had a lovely video message about the important role that education plays for transforming vaccination. So all in all, a very interesting first event of the series. Next slide, please. The 5 key takeaway message included that pharmacists are important actors in making vaccines and vaccine information available to the public, because they have very close links to patients and citizens all across the European region. Developing vaccination qualifications to make pharmacists competent to administer vaccines is a key factor for transforming vaccination. And we also had a lot of best practice sharing, which can help with bringing about change at national level. We also learned that advocating about the advantages that diversifying the provision of immunization services through the involvement of pharmacists can add is an important tool for bringing about change. And there we got some great examples from all across the European regions about flu vaccinations, which afterward they were also offered by pharmacists, actually increased the uptake of the flu vaccinations in the countries. And last but not least, we also hear that caution is an enabler that should be utilized. And these key takeaways were also partially reflected in the contributions from WHO, which was great, since the presentation of the WHO immunization agenda kind of tied together all of the previous presentations. Next slide, please. So the regional needs and priorities that we found linked to the need to use the lessons learned from countries that achieved a transformation of their pharmacy services. Belgium, for example, shared with us how the experiences from their neighboring country, France, helped them to drive forward change in their country. We heard about the importance of fostering undergraduate education and vaccination across the entire European region as a kind of stepping stone to actually kickstart initiatives at national level. And it was agreed by all that support is needed for the entire European region in the adoption of new vaccination models, so that all countries across the region can learn actually from the front runners and then implement these learnings in their own countries. Next slide, please. So the challenges that were actually experienced by the different speakers in transforming vaccination for pharmacists in their countries were very, very similar. A lot actually struggled a bit with turning pilot programs into nationally applied vaccination services. But they also shared how this kind of struggle turned into a success afterwards, especially because oftentimes regulatory obstacles that hampers policy change at national level were there. Since EHP is based in Belgium, I can very much relate to the Belgium example that was given, which outlined how difficult it is to actually work with the different national and regional actors to actually push for change at national level. And last but not least, also getting support at national level for driving forward change was not always easy. Next slide, please. In terms of the lessons learned, all speakers shared the view that pilot projects are a great opportunity to showcase the added value of involving pharmacists in the provision of vaccination services. And especially the first speaker of our event from PGU provided some great examples how these projects brought about change in several European countries. Also, as I already mentioned, the fact that uptake of, for example, of the flu vaccination increased through the engagement of community pharmacists also underlined their valuable contributions. Next slide, please. So concerning the legislative enablers and barriers, we spoke about the fact that legislative changes are very much dependent on national factors, but it was also acknowledged that linking success stories from other countries to the national context can help with bringing about change. Another takeaway included that patience and persistence are important since legislative change may take some time to be implemented. We saw that in the different examples that were given, which showed that in some countries, it took only about a year to turn a pilot project into a nationally applied service, while in others it took slightly longer. And last but not least, we also discussed that changes in government could both be a barrier and an enabler, because either all the work that was done with the previous government might have been lost, or it could be an opportunity to share the ideas with new representatives who might be more open to expanding vaccination services by pharmacists. I would like to conclude by highlighting that even though the feedback from the European region was very much focused on the experience of community pharmacists who had all across the region managed to implement and expand their services, also hospital pharmacists have an important role to play in our region, since they can share information about vaccines with patients and convey to their fellow healthcare professionals in hospitals the importance of getting vaccinated. So thank you so much, and back to you, Ron.
Thank you, Stephanie. Very excellent update, and sounds like a great conversation happening in the European region. The second of the 6 events, event 3.2, focused on the regional needs and drivers for transforming vaccination in the Southeast Asian region. This involved discussing the progress made in the region's countries with regards to the pharmacist vaccinations, the quality and universal access to vaccinations. They also discussed barriers and challenges and regional needs for future transformation. Once again, the WHO regional officer was also supportive and attended this event, and that was greatly appreciated. So I'm now pleased to introduce to you G. Sumalata. Suma is the executive committee member of the Southeast Asian Regional Pharmaceutical Forum. She worked at the Hindu College in Pharmacy in Guntur, Andhra Pradesh, India, from 2006 to December 2013. She is currently working as a professor and vice principal at Vikas University of Pharmaceutical Sciences in India. Participation, and we turn the webinar over to you. Thank you.
Thank you, Rona. Thank you very much. I'm Dr. Sumalata. At the outset, I would like to thank FIP President, Mr. Dominic, and CEO Catherine, Lina, Farah, Caroline, Lee, everyone for giving me an invitation to have a summary on this Transforming Vaccination Globally and Regionally Series 3. The Series 3 mainly focused on FIP member organizations across 6 regions, that how they have addressed the actions to deliver on the commitment to transform vaccines globally as well as regionally. regional needs and drivers for transforming vaccination in Southeast Asian region. All the speakers have given an excellent information about all these things, and myself and Ash were moderators for the episode. The speakers represented from WHO, Dr. Manisha Sridhar, and Dr. Rao, Mr. Kampanath, Mr. Lalit, and Mr. Yagya Prasad. The themes and topics covered in this episode is mainly they have the Southeast Asian region perspective was well understood in delivering on transformation of vaccination both globally as well as regionally. Next slide, please. And main 5 takeaway key messages from the Southeast Asian region event is identification of the needs and consideration of this transforming vaccination across the countries, and how the preparedness to roll out the COVID-19 vaccine and planning for this vaccine deployment to the public, and the vaccine readiness assessment tool Virat, to the transformation to all the countries by ministries of health with the support from WHO, UNICEF. In this context, Manisha Sridhar has mentioned they have designed a logo about this Virat, that is a Q. The Q stands for quality, especially. Next slide, please. And the fourth key point is immunization through the existing healthcare system like hospitals, dispensaries, and paramedical staff, everyone. So everyone should be trained in case of vaccination. And the rollout of vaccine cold chain management, logistics, especially where we have to take utmost care in management of this cold chain logistics, and the well-trained human resources by FIP developed training programs. Next slide, please. Then the regional needs and priorities identified to transform vaccination in our region is mainly pharmacovigilance of vaccines in monitoring and management is very much essential, because we have to identify the adverse event effects, and we have to monitor that adverse event effects, and also we have to manage that one. This was mainly mentioned by Dr. Rao Vadlamudi, who is the president of Commonwealth Pharmacists Association. And the advocacy to the government from national and international organizations is very much required. Next slide. And challenges experienced in transforming vaccination in our region is mainly procurement through medical supply division. So the procurement of this vaccine is becoming a challenge to all the forum countries, and need of central and regional storage is very much essential for proper drug storage in all the countries, and supply to end users by medical officers of health, hospital units, hospital wards, and patient care. Patient care is very much essential because this vaccine should reach each and every individual of the country. Next slide. And the lessons learned while transforming vaccination for pharmacists, especially all the pharmacists who gear up for COVID-19 vaccine, dissemination of vaccine news with all the adaptable guidance materials, tools, trainings, and advocacy materials. Especially pharmacists need to be trained in vaccinating these vaccine to the people. So this is very much essential. Next. I'm coming to the legislative issues which are facing by this region. Import of vaccine should be monitored by legislative authorities in a transparent way. So nothing should be misused according to this legislative law. And the legislation to enable pharmacists to be vaccinators is needed in all the countries. So that this was the gist of the summary of the Southeast Asian region speakers mentioned in this one. For this, really, the development goals which are introduced by the FIP turned out to be a great success because of especially teamwork, and really it is giving a lot of information to all the people across the globe for how this transformation of vaccination can be occurred both globally as well as regionally. Thank you. Thank you very much for giving me the opportunity. Over to Ronald.
Thank you, Soma. Appreciate the report from the Southeast Asian region, and very well done. I'll remind people if they wish to ask a question, please do so. They can do that in the chat or in the Q&A box as well. So in the third of 6 regions, event 3.3 focused on the regional needs and drivers for transforming vaccination in the Eastern Mediterranean region. This involved discussing the progress made in this region's countries with regards to pharmacist vaccination, the quality and universal access to vaccinations. They also discussed the barriers and challenges and the region's needs for future transformation. Once again, the WHO regional officer was supportive of this event, and their support was greatly appreciated. So I am now very pleased to introduce to you Nadia Al-Mazzouri. Dr. Nadia has a PhD in clinical pharmacy and is currently assistant professor at the Sharjah University in pharmacy, teaching in pharmacy practice and pharmacotherapeutics department since 2018, and considered to be the first local employee from the UAE joining the pharmacy college. She has several publications and is a member of the WHO Expert Advisory Panel on International Pharmacopoeia and Pharmaceutical Preparations, and the president of the EMRO Pharmaceutical Forum for FIP, the EMRO Pharmaceutical Forum for FIP. Prior to that, she was an adjunct professor in the UAE University teaching medicine and health in the PharmD programs from 2012 to 2016, which was the first professional program implemented in the UAE. Since 2016, she's been very busy with the armed forces, medical services sector. She has expertise in pharmacy management, clinical pharmacy, and supply chain management. This is only a very brief description of her qualities and qualifications, but we ask her now to begin her presentation. Welcome, Nadia.
Thank you very much, Mr. President, Chairman. I would like first to thank the FIP, especially the President and the CEO, and all the team for inviting me to give this brief about the Eastern Mediterranean region needs in transforming and to join this great program of transforming vaccination globally and regionally. Well, I'm going to start about the topic that we are going to discuss about transforming vaccination globally and regionally from Eastern Mediterranean perspective and experience, delivering the delivery of a vaccination service faces a unique barrier in many countries, especially in Eastern Mediterranean region. But issue and legislation, logistics, and resistance for other health professionals are common issue across this region, our region. So if we're going to talk about the primary takeaway message from the event, it will be a successful approach to introducing pharmacist vaccination in countries where it is legal in the Eastern Mediterranean. Include, first, we have to do lobbying decision makers and legislator, including the involvement of international organizations to support the position of local pharmacist organization. Also, a creation of a guidelines for vaccination by pharmacist framework for pharmacist role within the health system, and accredited training at the same time as a point 1, the first requirement, so the pharmacists are qualified and ready to contribute the moment that legislation catch up. Next slide, please. So the third point also, that inclusion of international organizations such as WHO, UNICEF, and FIP in the process of lobbying decision makers and development of training was a consistent theme. Addressing also a position from others within the healthcare sector is an important part of removing barriers against implementing the vaccinations. Addressing also vaccine hesitancy is an important aspect of improving vaccine uptake for all people. Next slide, please. So our regional needs, actual needs and priorities identified to transfer the vaccination will be ensure undergraduate courses includes vaccination training, provide also postgraduate training for vaccination, development of guidelines and framework for vaccine delivery, setting in pharmacy, re-accreditation, logistics, and cold chain logistics also. For this is the most important to be applied and to concentrate in. Lobbying of decision maker is a critical activity and should be accompanied with development of training guidelines and framework of vaccine delivery to ensure that the decision makers can see the evidence of pharmacists being qualified to deliver vaccination. International organizations such as WHO, UNICEF, and FIP provide significant support to the lobbying role of local organization. Next slide, please. So we found that the challenges experienced in transforming vaccination for pharmacists in our region, mainly attitudinal barriers for other healthcare workers who currently provide vaccination, especially where financial factors play a great role. Next slide, please. So the lesson learned while the transforming vaccination for pharmacists is that the development of pharmacist capacity should be developed prior to or during the lobbying process, so that the pharmacist capacity to vaccinate exists or is being developed at the time that legislation or regulation empower them to act. Next slide. The key vaccination related legislation enablers and barriers emerging in the region, in our region, that we found that the primary legislation enablers are those that recognize pharmacists as a vaccinator under the law. Also, other legislative factors include laws that control the distribution and funding of vaccines, ensuring these do not prevent pharmacists from participating. Next slide, please. And this is the last message to you. Back to you, Doctor. Thank you very much for your time.
Thank you, Dr. Nadia. Very helpful and very important information coming from the Eastern Mediterranean region. Thank you so much.
You're welcome. Thank you.
And we're moving right along now in the fourth of the 6 regions. Event 3.4 focused on the regional needs and drivers for transforming vaccination in the Western Pacific. This involved discussing the progress made in Western Pacific countries with regards to pharmacist vaccination, the quality and universal access to vaccinations. And also there was the information on the barriers and challenges and regional needs for future transformation. I'm now very pleased to introduce to you John Jackson. John is a pharmacist with broad experience and expertise in pharmacy practice, policy, and governance. He's currently engaged in research at the Faculty of Pharmacy and Pharmaceutical Sciences, Monash University in Melbourne, to develop enhanced roles for pharmacists in primary care and metrics for pharmacy services. He has experience in hospital, community, and residential aged pharmacy practice. He is a president of the Victorian branch of Pharmaceutical Society in Australia. He has served on many boards in Australia. He is currently the president of the Western Pacific Pharmaceutical Forum for FIP. John is involved in supporting the development practice, particularly in the implementation of FIP WHO's Good Pharmacy Practice Guidelines. John, I turn it over to you. Thank you.
Thank you very much, Ron. It's a pleasure to be here. And I would like to thank FIP for the opportunity. I'll start by just giving an overview of what we found from our project. There are a couple of countries, but probably only two, as best we understand, that have established pharmacist administration of vaccination in the Western Pacific region. There are a couple that are in the process of training pharmacists, although they have yet to resolve the legislative barriers. There are many, though, that have not progressed this area of practice at all, and a number that face very significant cultural and legislative barriers. So if I can have the next slide, I'd just like to thank the people who participated in our event on the 8th of December and all those who joined us. In fact, I'd prefer you to return to the previous slide, please. There are 3 points I'd like to make in relation to pharmacist vaccination. If we are to expand into this area of practice, we need to be able to demonstrate that we conduct our current roles in relation to vaccines to a high standard. And so that's our cold chain distribution, it's our supply of vaccinations, and it's our involvement in public health messages around vaccination. The next thing to note is that the administration of vaccines by pharmacists is in fact a grey area in some countries. It is neither allowed nor disallowed, which can be a challenge. And the final thing to note in this opening stage is that in addition to gaining approval to administer and training in administration, we need to also ensure we actually have access to the vaccines that we hope to administer. Next slide, please. So the key things, the 5 takeaway messages from our forum was that advocacy is critical, and many countries identified the value of agencies like FIP and the regional forums assisting them in advocating with domestic stakeholders, their health departments, their regulatory agencies. The next thing is that legislative issues is of great variation across our region. It is the one thing about vaccination that is most variable country to country in our region. If we can resolve the legislative barriers and move into the administration of vaccines, training is not a major problem because pharmacists are well trained in therapeutics already, and it's really just additional techniques in administration that would need to be addressed in the training. Next slide, please. The final 2 takeaway messages was that if and when vaccination is introduced, presumably starting with a research project, then a pilot, once it gets introduced, it's going to be with a key necessary vaccine. In my country, that was influenza vaccine. It will, of course, depend upon local health conditions as to what that will be. But what we observe is stepwise introduction of additional vaccines based upon local need and stepwise increase in the range of people that pharmacists are able to vaccinate. So the lesson here is start on a focused essential need and stepwise increase through working with the regulatory agencies as and when possible. And the final of these 5 take-home messages is that we need to address the pushback that can come from other health professionals, be they doctors or nurses. And the way we address this is by, 1, stating that vaccination fits within pharmacists' scope of practice, but more importantly, by pharmacists implementing that scope, administering vaccines, we're not taking roles or work from others. Our objective is to expand the total number of people in our population who are vaccinated, because no country can claim to have complete vaccination coverage as yet. And if I can have the final slide to consolidate these points. Most of the impediments that I've spoken about, like training or public perception, the pushback from the medical professions, is fairly consistent. They are fairly consistent across the countries of the region. And so the solutions will be quite similar. They're almost universal in nature. But as I said earlier, it's legislation where there is greater local variation. In some countries, that variation in legislation is at a state level, not even just a national level. And consequently, it's in this area of legislative barrier where we need to develop country by country solutions. Thank you very much.
Thank you, John. Excellent work and great report from the Western Pacific region. Appreciate that. And no question that access can be enhanced by having pharmacy-based vaccinations, and it doesn't take away from vaccinations in other areas. It certainly adds to the overall picture, and thank you for raising that point. And just a reminder, for questions, please indicate that in the question and answer box, and our panel will be able to get to those questions at the end of their presentations. We're now moving to the fifth of 6 regions. Event 3.5 focused on regional needs and drivers for transforming vaccination in the African region. Can we move the slides forward, please? This involved discussing the progress made in Africa with regards to pharmacist vaccination, the quality of universal access to vaccinations, and as with other events, barriers and challenges and regional needs for transforming or for future transformation were also discussed. I'm very pleased to be introducing to you Prosper Yaeg. Dr. Yaeg obtained a state diploma of Doctor of Pharmacy at the University Paul Sabatier in Toulouse in 1984. He is the head of a pharmaceutical industry in Africa. He is also an international pharmaceutical consultant, social entrepreneur, and defender of quality of drugs and healthcare access in Africa, and a fervent activist for universal health coverage, especially in Africa. He's also a member of the FIP Council and president of the African Pharmaceutical Forum and president of the National Order of Pharmacists of Cameroon. He has made significant contributions to actions aimed in promoting health and large-scale vaccination coverage, particularly in the fight against poliomyelitis, HIV, malaria, and other diseases. He advises many organizations and associations in areas of health communication, pharmaceutical ethics, professional conduct, public health, and drug strategies. Prosper, we look very much forward to hearing your report. Thank you. Prosper, please, you might be on mute.
Thank you, Ron. I would like to thank the president of FIP, Dominic Jordan, and CD for the work, for their support to Africa. We had a very interesting event last week with good speakers, very interesting speakers, knowing perfectly the situation of their country, from Ghana, speaker from Algeria, from Kenya. And I gave a few words of the situation in my country. But I was also moderating the event with Jacqueline Surig. Jacqueline is our liaison officer. She is the vice president of FIP. Next slide. We talked, next slide, the 5 primary takeaway message from that event. were that just a few countries in the continent where pharmacists are authorized to vaccinate. This is not a good situation. It has to change. We have vaccination in Ghana, just a small volume of vaccination. Vaccination permitted in Algeria, but practices in pharmacies, in community pharmacies, and in Kenya. All the other countries, vaccination is not permitted to pharmacy. The other message was the importance of advocating politicians, other healthcare professionals, and stakeholders. Pharmacists as an accountable asset in vaccination coverage. The third message, the importance of education to empower pharmacists. Fourth message, vaccination training should be included in the pre-graduate pharmacy curriculum. At the end, vaccination by pharmacists should be legalized, recognized, and financially supported. Next slide. Next slide, please. The regional needs and priorities identified to transform vaccination. As I already said, advocate regulatory stakeholders and politicians on the asset which pharmacists represent to increase vaccination coverage and on absence of regulation, an ambiguity of regulation should disappear. Advocate for other healthcare professionals to raise awareness, establish collaboration, advocate pharmacists and give them trust and confidence to encourage them to vaccinate. Education, this is fundamental. Education, we should have education workshops on vaccination in pharmacy school universities. The support of FIP will be important for that. Vaccination training should be integrated in graduate pharmacy curriculum for the future. We need support, financial support to vaccinate in our community pharmacies. It should not be free. We have to think about the remuneration. Next slide. The challenges experienced in transforming vaccination for pharmacists in Africa, the challenge with other healthcare professionals, I said, I highlighted that already. Challenge of pharmacists that they should enter in immunization. The challenge for the law, the challenge of logistic issue, the non-respect of the cold chain in major countries. It's a major challenge. Financial challenges, no budget for vaccination for pharmacists in main countries, no budget to vaccinate for community pharmacists. Next slide. I would like just to conclude that we need the support of FIP. We need the support of WHO. We need the support of other organizations to transform vaccination in Africa. Pharmacy can do that. Pharmacy can make it and successfully. Thank you.
Merci beaucoup, Prosper. Great presentation, great information, and great work you're doing for the Africa countries. I'll now invite Lena to introduce our 6th event. Lena, can I turn that over to you?
Yes, surely, Ron. Thank you very much. And thank you to Prosper and all of our esteemed speakers for showcasing the regional outcomes. We are coming to the last but not least region for today before we move on to the next part of the event, covering the Americas. This was the last event we've just delivered on the 10th of December, so only very recently. And today we have Eduardo Savi. Let me just quickly tell you about the event before I introduce Eduardo and ask him to share his reflections. So this was the final 6 of the 6th region, and this event focused on the regional needs and drivers for transforming vaccination in the Americas. And it involved discussing the progress made in countries in the Americas, and you see there on the slide that summarizes the speakers of that event. We had different countries covered, including Panama, Uruguay, Argentina, Ecuador, Paraguay, among others. So we've had a great lineup of speakers that can share experiences from their different countries. The event was also run in Spanish to ensure as much uptake as possible. So feel free to go back to the recording should you want to catch up with it. So with us today, I'd like to introduce Eduardo Savio. And I'll move to the next slide to introduce him. So Dr. Eduardo Savio served as the chair of the FIP Policy Committee on Antimicrobial Resistance in 2018. He has served at FIP in different capacities as well, for example, as Vice President of the FIP Bureau. Currently, he is President of the Pharmaceutical Forum of the Americas, of course, our regional partner in the Americas. He has been very internationally active with more than 150 presentations in international conferences, and 151, including today, probably more. He is head of the Nuclear Pharmacy Department at the Uruguayan Center of Molecular Imaging, and also member of the directive board of this institution. He performed as an expert for the International Atomic Energy Agency in several countries worldwide in the fields of radiopharmacy and radiation security, as well as being a professor and academic director of the hospital pharmacy specialization. As a researcher, Savio is a member of the National System of Research and Innovation, and he served as editor of the Uruguayan Journal of Pharmacy and Chemistry for 30 years. Eduardo, thank you so much for joining us today. We welcome you and ask you to please tell us more about some of the outcomes that have emerged from the Americas.
Okay, good morning from Montevideo, Uruguay. It's a pleasure to be virtually with you. Thank you, Lina. Thank you, Ron, for the invitation. Would like to express our great gratitude for the executive, on behalf of the executive board of the Forums of the Americas, to FIP, to Dominique Jordan, to Catherine, and to all the staff, because of the huge effort that has been done along the last 3 months, September, October, November, and that is concluding today. It has been very useful for our region, and I think in a worldwide perspective. In the American region, the themes and the topics that covered, we started with a very interesting presentation of Argentine, where pharmacists are participating in national vaccination programs of influenza and pneumococcal since the last 15 years. They have a great and very important experience in terms of immunizations. They have very requirements established in community pharmacies, and community pharmacies are regarded as educational and also service centers. The National Organization of Pharmacists, that is COFA, participates in a committee that is in the Ministry of Health as a consultant group in terms of immunizations. The barriers that are needed to be addressed to participate of immunization programs have been achieved along many years, and now it's recognized this participation. But this situation is also in place in other countries, such as the United States, Costa Rica, some states of Brazil, and Chile. So the added value for the population, for the health systems, and for the pharmacists of participating in immunization in this group of 4 or 5 countries is already in place. Next, please. So the main issues the main message from this event has been that the contribution to improve vaccination rates of non-obligatory vaccines where immunization services were introduced at pharmacy level has been achieved, and it is very important that pharmacists One thing that is clear and is a requisite must be in the pharmacy with suitable training, both that this training could be delivered both at pre-graduate or in programs of continuous education level. That several countries has introduced the importance of moving forward to enable immunization services in community pharmacies. And this has been the situation that has been addressed by Panama, by Ecuador, by Uruguay. And unfortunately, because of internet server connections, Paraguay could not deliver its presentations. And that a literacy framework and that training opportunities and technical requirements should be in place before starting immunization programs. And here, all the people that who are participating of this activity, we know that to share the international experience, which pieces of this experience can be translated into local or regional is very important. Next one, please. So in terms of our needs and our priorities, we are fully aware that COVID-19 have altered all the plans, and in some countries they have been, because of budget restrictions or because other priorities had to be covered, it was not the regular vaccination plans was not possible to be fulfilled along this year. So needs were identified, and there are a gap that has been generated and that it will be necessary to be fulfilled in the very near future. In some cases, in some countries, we identified that vaccination rates are needed to be improved, and that pharmacists wish in every country that do not have immunization programs, they would like to have this kind of program in community pharmacies in several countries. And of course, each country has a different context and also a different perspective. Next, please. So the challenge that we are faced to, that everybody agreed that we need to be trained, that this training can be introduced in different level, pre or postgraduate level, but the importance is to generate competence to deliver immunization services, that national regulations should be changed in order to recognize this possibility of delivering this kind of services. And it still exists, unfortunately, an important percentage of the population in our regions that has not suitable information about immunization programs and which are the advantages. That this fact that here are the people that are convinced, and we know which is the importance, but there is an important part of our population that is not aware of this fact. And we consider that the Ministry of Health and the deans of pharmacy schools should be engaged in this process as representative of these two kinds of organizations. Next, please. Sorry, and there was a final slide that I would like to mention, that we have in the immediate program the proposal to have a guideline that is already completed in Spanish and that will be translated into Portuguese and English, and that will soon come in order how to implement immunization services. This has been developed in Costa Rica along with a grant from the pharmaceutical forums of the Americas, and that we also will create a working group in the pharmaceutical forums of the America to support all those countries that are wishing to move forward and to take the development goal of FIP in this particular issue to have the necessary support. It is important that our professionals have the certifications that they are trained to deliver this kind of program. So thank you very much for having this possibility. I would like also that Dr. Nuria Montero, who is the Director of Pharmacy Practice in our regions, she has been very supportive and leading all these issues in our region. Thank you very much.
Thank you very much for this, Eduardo. Really, really great reflections. And we can see so far, listening to all the 6 regional leaders, that there are indeed a lot of common issues. And one of those we'll focus on a little bit more now in the next part is actually the issue of policy and specifically regulation. Of course, Ron has introduced himself as also the chair of the FIP Regulators Forum. And so in his capacity, he will also be speaking shortly about the work of the forum, but also how it relates to influencing the vaccination agenda in pharmacy. So without further ado, Ron, the floor is yours. Looking forward to hear more before we start a discussion with everyone.
Thank you so much, Lena. And if we can have the first slide, please. So I'll just take a few moments to provide a description and an update on FIP's Regulators Forum. It's a relatively new concept. We began work in 2017, 2018, and had our first meeting in 2019 of the working group, which gave then birth to the Regulators Forum. Many of you will know Dr. Sylvain Grenier from Canada. He was the first chair of the forum. The terms of reference of the forum were passed just in September of 2020, and we developed a mission to provide a global platform for pharmacy professional regulators for sharing best practice among peers, emerging trends, and the needs for the professional and associated regulations, thus contributing to protecting the public and achieving optimal health outcomes through a confident and adequately regulated pharmacy profession. Next slide, please. There are many objectives developed by the Regulators Forum. These are an excerpt of some of the objectives. They're pertinent to our discussion today. And overall, it's an opportunity to share good practices regarding public protection. And it's an opportunity to exchange information and share ideas among the regulatory bodies and the oversight and the roles that they perform. And it's also to advise the FIP leadership team and collaborate with the World Health Professions Alliance partners. And again, this is only an excerpt of all the objectives of the Regulators Forum. Next slide, please. The Regulators Forum has a list of possible activities. You can see the bullets there, a large menu of activities, but it's very safe to say that we focused primarily recently on the third bullet regarding the COVID vaccination and the COVID pandemic challenges in the regulatory environment. And I'm sure that rings true for most people on the webinar, how your activities are focused, but the Regulators Forum does see a larger picture about possible activities of the forum, but presently focusing on the challenges of COVID. Next slide, please. So FIP has done some phenomenal work for transforming vaccination. Most recent survey that happened in just earlier this year showed how there's been a large increase even from 2016 for a number of countries that have pharmacy-based vaccination programs. However, there's still more work to be done, and we've heard today from our presenters in the various regions that even though some locations have pharmacy-based vaccinations, there's still other regulatory oversight work that needs to be done. Certainly where the vaccinations require a prescription, it only makes sense to have the pharmacist's ability to prescribe those vaccines so they can administer them as well. And also, the important from a public protection perspective is the idea of having a national vaccination recording system and the pharmacist able to access that system to make certain that people are receiving the vaccinations they need and they're not being duplicated, but also have the ability to document in those national vaccination systems as well. Next slide, please. So one of the things that that we're working with is, thank you, is to develop a self-assessment tool for the preparedness of pharmacy-based vaccination. So this self-assessment tool would work through a country or a region's or a state's preparedness for implementing pharmacy-based vaccinations. And as much as those locations might very well have them or not, they would also identify the risk factors of what their current status is around vaccination services out of the pharmacy. And it goes beyond just vaccination. It also will assess the ability for pharmacies and pharmacists to administer tests. In this example for COVID, performing the nasal swabs. Also the opportunity to prescribe vaccines if that's needed according to the legislation of where the vaccines are listed in the schedule. But also during the pandemic, there's a challenge around the chronic medications patients also need. And there is difficulty at times for the pharmacist to receive the authorization from the prescriber. So there's importance to look at the ability of pharmacists to provide continued care prescriptions for the chronic medications. And for those patients that have the minor effects of flus, to provide minor treatments and assess the patients and provide the minor treatments as well. And clearly, as we heard from our speakers all through the presentation today, is some issues around supply chain management. So this assessment tool is coming soon. We haven't quite put the final document to bed, but we're still in the development stages, but we look to have that document completed very, very soon, and we'll keep all the regions posted on when that's available and when they would be able to access it. Next slide, please. So that's a brief update on the Regulators Forum, and we want to turn to our panel and get them the opportunity to respond to the question that we've identified as a common theme, and that is to ask, how can FIP support the countries in your region to shape policy around vaccination and pharmacy? And as you come to respond to those questions, we're also very, very fortunate to have Catherine Duggan, the CEO of FIP, joining us shortly, and she will listen to your suggestions and thoughts, but also be able to provide the FIP perspective on this question as well. So I'll pause for a moment to ask Suma to lead off the discussion in response to this question, but also look forward to the response from each of the regions and the representatives we have listed on the slide. Suma, please. Suma, are you there? You might be on mute.
Yes.
Thank you. So how can FIP support the countries in your region to shape the policy around vaccination and pharmacy?
Actually, really, we are very much thankful to FIP because we are from CFOM region. We have 8 active member organizations. Among these 8 active member organizations, earlier we don't have any communication between the organizations. Then we have tried a lot to be in contact with them. Then we have sent a letter to FIP. Then immediately FIP has sent a letter to WHO. Then we have a contact with WHO CRO. That's why Dr. Manisha Sridhar was appointed as a WHO CRO. In this way, FIP helped in establishing contact with our WHO CRO member organization. And also FIP helped in addressing Ministry of Health on utilizing services of pharmacists in vaccination and other healthcare programs. That's what among all CFOM region, we are very proud to announce that our India listed pharmacist as a potential vaccinator among all the healthcare professionals developed. And FIP is also helping in framing online training programs of vaccination. We request FIP to incorporate all our CFOM countries in development goals. Especially, we need in competency development, academic capacity, communicable diseases, and policy development goals. We request FIP to incorporate our countries also for guiding to identify and take up local needs through this FIP development goals, and helping in establishing contacts with member organizations really help. FIP helped us a lot. Thank you.
Thank you, Suma. Dr. Nadia. Dr. Nadia, are you there?
Yes, sir. Yes, with you. Thank you. I think we should go. Yeah, I saw too many really challenges in different countries. This is what we are doing. Thank you very much, really, for discussing these points. As we are sharing a lot of challenges, most of the forums, and for the success of that, we have to unite together and making a step forward to implement the vaccination program with a professional way. That getting the legislation, with the training, with the guidelines for and to provide also a good atmosphere for vaccination to be started. I'm so happy that I found that in the Americas, they are applying the vaccination program in their community pharmacy. Thank you very much, sir.
Thank you very much, Dr. Nadia. Prosper.
Yes, Ron, merci. What I wanted to add is that FIP can support, FIP is supportive. We have received the letter, the model of the letter to write to our ministries, health ministries, to transform vaccination, to encourage vaccination by pharmacists. But this has to go with training. In that way, I think that with the support of FIP and the universities can put in their program the vaccinations for training for new pharmacists. It is important to have that. You have United States and Europe, you have not won the vaccination combat in 1 year or 2 years. It is a long way. We have to begin somewhere. We have to begin globally, regionally. The support of our organ important for making WHO respecting receiving pharmacists in the health programs. Thank you.
Thank you. Thank you so much, Prosper. Excellent points. And Stephanie, how can FIP support the countries in your region?
I think my feedback is very much in line with what a lot of the previous speakers have said. So from a European perspective, I think FIP can provide a lot of support in connecting the dots. As mentioned already in some of the questions that are raised in the chat box, a lot of countries are actually looking for some input, how they can set up vaccination services in their own country. So it would be very, very good if FIP can actually help in collecting all of the good initiatives that have been implemented, and also share the steps that were taken, how to implement these, and also to underline what worked well and what did not work so well. And I also think that the self-assessment tool for the preparedness of pharmacy-based vaccination that you just shared could be a very great and helpful tool to actually also get the countries here in Europe that don't have vaccination services yet to convince their national governments that it would be a good idea to implement them.
Thank you, Stephanie. Excellent thoughts, and you've tied everything very much together in the presentation today and identified some common themes. John, your response, please.
Thank you, Ron. Look, to get a government to change its policy and consequently its legislation is a political process, and it will need popular support in the country. And as I've said in my talk, it is legislative change that is necessary. That's the most significant barrier. So we need to get popular support for this legislative change. And if I, as a pharmacist, go to my politician and say that pharmacists should be able to vaccinate, it is seen as, to a certain extent, a vested interest. If I can convince the public to go and see the same politician and say that they need better access to vaccination, then I think the politician listens with a more acute ear, because they are dependent upon that populace for their role. So how FIP can assist is to help us do local analysis of what the specific legislative barriers are, or the processes for getting legislation changed, and developing the messages that can convince the public to push for change in policy and change in legislation. I think everything else falls in place after that's achieved. We have to do this on the basis of the public's need and acceptance, not on the basis of pharmacists' desires or self-interest. Thanks, Ron.
Thanks very much, John. Excellent points. I keep looking down and making notes as people are speaking. Some very, very salient points. And certainly last but not least, again, Dr. Savio.
Okay. Thank you, Ron. Well, I think that today we have a worldwide perspective after this activity, and this is very useful. We thank FIP also for the toolkits that has been announced. I think that is a very important a tool for us to move forward into every country to identify which specific barriers and which is the state at that in a certain moment. In our region, I think that FIP, we have a good relation with PAHO, that is the WHO office for our regions in the Americas. But it is important to reach at the highest level in order to promote immunization services from the WHO to every country. That would be an important thing. We have another important tool that is Pan-American Conference of Education that is in place for the last 30 years, also sponsored by PAHO, and where we can introduce, we can submit and work the advocacy to introduce in every curriculum of every school of pharmacy, teaching and training in immunization services. That would be another driver, and also in order to create the momentum and to create the conditions to change national legislation in every country. I think that the FIP is in the right directions, and we need to achieve more support for those countries that are more in the back, in order to push them to arrive to the goal of having immunization services in every country by the pharmacist. Thank you very much.
Thank you very much, Eduardo, and great comments by all the panel. And we've captured those comments not only on paper, but on video, and we will take an opportunity to review that. But now I have the great pleasure of introducing to you Catherine Duggan, the CEO of the FIP organization. Next slide, please. Catherine will join our webinar very shortly, and her face and her voice are very well known around the world. But by way of introduction, Dr. Catherine Duggan is the Chief Executive Officer of the International Pharmaceutical Federation. She took up that role in The Hague on June 2018. Catherine is responsible for the visionary leadership, support, development, advocacy, and growth across the 150 member organizations and the 4 million members that FIP represents. She's responsible for developing and delivering strategy, planning, working, and sorry, I just lost my slide here. Pause for a moment, I apologize. She's also responsible for, sorry, Catherine. She's also responsible for developing and delivery of strategy, planning, and working in global organizations such as the WHO, the UN, and other international professional groups. Catherine, it's really my pleasure to turn the meeting over to you for response to the panel discussions and for some additional important information. Catherine, please.
Thank you so much, Ron. Thank you for your kind words, and also to all our roundtable participants today. What a day it's been. And I have to say, you've left me with a very easy task, really, to answer the question, what can FIP do to support you in your countries? And I've been looking and monitoring the questions as they've come up throughout the session. So I hope some of the summary points I make will address those questions as we go. And as you say, Ron, we've got the recordings of everything we've heard today already. Before I start, I just want to mention FIP is not just our team. When I say how FIP can support you in your countries, it's not just the team at FIP or HQ, but much wider. You've heard today about how we work with and through our regional forums, our member organisations and our individual members, our boards, scientific and practice boards and FIPED, our sections, our special interest groups and our hubs. Really, I just want to make that point that FIP will never do anything alone. We always do it together, and it's our pleasure to do so. So I thought I would sum up using some of the questions I've seen in the Q&A box to help with 6 main areas where FIP can and will support you and your country through policies. I noted that Javier asked a question around how can countries learn from each other using the example of Spain and Portugal. Well, I think we can do this, we will do this. We have country case studies in our advocacy toolkit. But through 2021, we need to do the same across our regions, so from region to region. Secondly, I heard a lot about access to quality education and training. And as in Series 1, we will need a framework that describes to everyone what is needed for undergraduate, what is needed for postgraduate, for continuing education. As John rightly said, we don't need much training when we're in the workforce, but we do need to demonstrate competence. And many courses and organisations have training packages. We will assure the quality of these so all of you can access them. A third point was logistics. We heard a lot about the supply chain, the need for us to be conversant and expert in the cold chain management, especially with the Pfizer vaccine. And this, again, will complement some of the outputs from Series 1 around our guidance. Fourthly, I wanted to commit that we will work with other professions to reduce resistance and gain support. And we have been doing this through the World Health Professions Alliance. We were at an event the other week where the International Council of Nursing supported pharmacists to vaccinate. And we know that there is some resistance in countries from nurses to pharmacists, and we supported the ICN in their endeavours as well. We'll also do this with other agencies, for example, the International Federation of Aging, and we've seen what great support they've given us with our great colleague and friend, Jane Barrett, in some of the presentations. A fifth initiative will be guidelines and support. Really, when I heard what work has been done by the Americas, Eduardo, we would love to work with you to use your experiences with our practice guidance that came out from Series 1. Really, there's no point in us duplicating work from part to part or country to country. The final point, and it comes on to my next slide, is advocacy. We heard a lot from all of you that you needed awareness and lobbying and showcasing, and also not showcasing for self-interest, but showcasing with evidence of how when pharmacists become part of the vaccination program in a country, there is greater access for all our patients and the public. So we would want to provide support, and I've got an example for how we've just done that. As was said, we need to do this country by country. But in addition, and I build on what Prosper challenged us with, we don't want to wait for all the work to be done in sequence, piece by piece. If we can support countries to do many pieces of work in parallel, then we can maintain momentum and we can deliver what our patients and the public need. So for me, there are 6 big asks. We will put them into our work plan, and we'll make sure that this is all presented and collated at our summit on Thursday this week. Now, I think it's really important that I showcase for you the very recent advocacy piece of work. You'll see the slide in front of you. And as a bit of background, I wanted to let you know, as new vaccines against SARS-CoV-2 are regulated for use and come into the market across our different countries, we know that our countries need to prepare for mass immunisation strategies. It is now time to harness the contribution of all health professions towards a historical effort to achieve collective immunity against the COVID-19 and to bring the pandemic under some form of control. As we all know, a high vaccination coverage is an essential stepping stone towards improved global health, economic recovery, and social well-being for all our communities. At this crucial moment, FIP stands with its member organisations. We prepared a template letter for your ministries of health that makes the case for engaging pharmacists and pharmacies in vaccination strategies. This letter was sent out yesterday and is meant to be co-signed by the presidents of FIP and your organisation, really showing solidarity, really showing how we support you in this endeavour. We need to link your country's strategy with the global efforts by our profession against the pandemic. We also note that it'll be even more impactful if all the organisations within a nation sign one letter in solidarity and unity, although we do know that this can be tricky to coordinate. The letter is available in 7 languages as of now: Arabic, Chinese, English, French, Portuguese, Russian and Spanish. And your organisation is welcome to use this letter as it is or to adapt it to suit your specific needs. We apologise if the letter is not available in a language of your country, and we invite you to translate it and let us have a copy. Please contact us at the headquarters, send your letter with your logo, your president's signature, and any changes you wish to introduce. You can do this through track changes. We'll return the letter to you, signed by the FIP president, as swiftly as possible, so you can forward it to your Minister of Health. We look forward to hearing from you, and we hope you may find FIP support valuable at this important moment. This does not mean that we want to push artificially countries into the vaccination. With pharmacists, we just want to raise the awareness at the Ministry of Health level that pharmacists are ready, willing, that there will be training that can support the pharmacy profession coming up straight behind it. Thank you, Ron, for my observations. What a great session. Thank you for your chairing.
Well, thank you so much, Catherine. Just amazing work by FIP, and certainly under your leadership. And that letter of support is a great initiative to the ultimate goal of expanding safe patient vaccination programs on a worldwide basis and include a pharmacy-based program to support that initiative. Now, we're getting very close to our allotted time, but we still have a few moments, and I'm wondering if I can turn it over to Lena just for a few moments to see if there's a question or two that we can direct to our very knowledgeable panel.
Thank you for that, Ron. In fact, Catherine has answered most of the questions, which were all revolving around FIP's role in supporting advocacy and overcoming regulatory and policy barriers. However, we do have one question that perhaps we could ask Catherine to expand on before we close, because we really are running out of time. And I think, Catherine, you may have already answered some of this partly, but is FIP developing a guide that will be adopted by countries in training and capacity development for pharmacists in the area of vaccination?
So, Lena, just to really clarify for everybody, we will be developing a guide and a framework of what good training looks like, the components of that training that would be useful for both undergraduate curricula, but also for us in the workforce. And we will also be producing a guide that tells us how we might quality assure the individuals at the end of such a training, how we may adapt assessments, and what we might call credentialing or some form of recognition of that practitioner. We have a lot of organisations who have training already, so we would want to recognise that training with an FIP seal an assurance that our members can trust that training, that it's meeting our standards and our guidance. And in this way, Lena, we make the beauty of the partnership between our member organisations and FIP work in practice. We would not develop our own training, but we would showcase the excellent training that exists already. And if there are any gaps, we can co-create some of the training that might be needed. But I think it's super important for member organisations and individuals to know that we will be producing a guide. I would envisage that a dozen providers of education will be able to demonstrate the FIP seal within the first quarter of 2021, because some colleagues out there need training right now.
Absolutely, Catherine. Thank you for that clarification and for reinforcing how urgent this matter is, especially in light of COVID. And I know we'll actually highlight this in the summit as well, how there have been even more global imperatives that that make us need to act really quickly. And we'll do our best to support our members to do that, to respond to those emerging needs. We are coming to an end, so just a couple of things we wanted to tell you before we close. We have developed this 1-minute survey, so emphasis on 1 minute, that can help us at FIP understand preparedness in terms of vaccination against COVID. So please hold up your phone and open the camera, scan that QR code, and that will take you to that very simple survey. Your responses will be really, really helpful, and we'll be actually sharing some preliminary results from this 1-minute survey at the summit on Thursday. So we've said the word summit so many times, but we cannot emphasize enough how important it is for us to have you at the summit. So we'll go to the next slide actually, just to tell you a little bit more. So the 24 events are actually finally coming to an end. Finally, it's just bittersweet because a lot of work will follow, but we do end 2020 with this 5th Global Virtual Summit. It's the first virtual summit FIP does, and it is the program finale for this transforming vaccination program, where together we will commit to action to transform vaccination in pharmacy. We will launch the global commitment to action. We will also hear again from the regional leaders who've been with us today, who will sum up really the key issues that have emerged from the region, and that will be a very small roundtable shared by the FIP President Dominique Jordan. We'll be also featuring lots and lots of videos, some from pharmacists, pharmacy workers around the world, who will tell us why this is important for them, and as a reminder that we are doing this to help them with delivering better services. Please join us at the summit. We've shared links in the chat. Please register, it's free. Please share it across your networks. Thursday, 17th of December at 2 p.m. Central European Time. Join us for this 2 hours. We look forward to engaging with you there. And as a final note, I'd like to thank our speakers and my co-moderator and of course FIP CEO Catherine Duggan for her intervention today, which was extremely valuable. And we look forward to having you with us at the summit. Ron, final words from you before we close.
Thank you so much, Lena. And just a great day, phenomenal participation. I think there's over 130 people or locations dialed in, and we don't know the total number that actually viewed it, and also the viewing of the tape. Great response, much work being done, much more work still to be done in this challenging times. Thank you, Lena, for co-moderating and virtually holding my hand as we walk through this today. I appreciate that so much. Catherine, great message, great work, thank you. And also the technical team that makes us all look so well in more ways than one, and gives us reminders to clean off our lens so we look even sharper than we might very well be in real life. Yes, we'll see you all in a couple of days at the summit. Thank you again for joining us, and thank you again to FIP for bringing this information to us all. Bye for now.